Dr. Shepard, as always, good to talk to you. I want to start with a clip of the president from May. Take a listen.
Therefore, if you've been fully vaccinated, you no longer need to wear a mask. Let me repeat, if you are fully vaccinated, you no longer need to wear a mask.
That was in May. In July, the president declared the nation's independence from the virus. Did the president and top health officials jump the gun, allowing us to remove masks now that we're seeing this surge?
Yeah, at that time when it was for the mask to be removed, for those who were fully vaccinated, that really was an opportunity for us to put the trust in the public to do the right thing. Now, what we are seeing is that because we have a surge and we also do have a variant, that is not going quite the way that we would have anticipated. If we had more people vaccinated, we would not see this surge and these hospitalizations and the ICUs filling up.
The president did set forth this new plan today, basically a reset from the White House to tackle the pandemic, but we're already in the throes of a surge. A lot of concerns as we move into the fall. So is it too late to be making these choices? Will it make a difference?
Absolutely. We know from messaging before by, giving options on how to, when to, and get these vaccination programs rolling. This is when we've seen, and we've even seen this in history, when mandates are made, that is more so when we see people actually getting their vaccines. We are at a precipice where we have, again, a strain on the healthcare system and also people dying and increases of admissions of children now, which we didn't typically see early on in the pandemic. So more now than ever, we need to take that stance when it comes to making a mandate, because we have to do the best thing for the community. And that means getting more people vaccinated. And that's exactly what the president did today.
Also new tonight, caught our attention, Moderna working on a hybrid COVID flu vaccine. Is that a good thing?
Yeah, that is actually a great thing. What I think we'll start to see in the future is, COVID is here to stay. We're just trying to decrease that severity of what the virus can actually do. But annually, we will actually start to see possibly where we may have our annual COVID vaccine, such as we see with the flu. And that, again, goes to the fundamentals of science. This is what viruses do. And really, it is curbing the impact of this particular virus right now. And that may mean in the future that we may have to get annual COVID vaccines. So having that technology and kind of that foresight to start that process now is rather smart.
Evolving with the virus. Dr. Shepard, as always, thanks for your time.
Thank you.